Dealing with the death of a child. The death of a child is a tragic and dreaded event. In our society, we assume that only old people are supposed to die. The death of a child will not be an easy subject to talk about. This will be especially so for the family and as an EMT basic involved in the call that requires involved the death of a child, you will also likely experience stress. Your responsibilities may be to help the family through the initial period of death until more definite professional help can be available. May be in the best position to help the family begin to cope. The death of the child will affect its stability and endurance. Can help the family through the initial period. Helping the family. They need to acknowledge the fact of the death. That's important. This should be done in a private place. Even if inside the ambulance, often parents can't believe the death is real. Some parents show little emotion to the news, to the initial news. If possible, find a place where the mother and father can hold the child. It is important for the grieving process. It helps them lessen the sense of disbelief and makes the death real. You should tell them that they may. Even if the parents do not ask to see the child, you should tell them that they may. Your decision in permitting the parents to see the child may need some discretion. This may involve preparing the parents for what they will see and changes brought by rigor mortis, asphyxiation, and so forth. Do not overload grieving parents with a lot of information. At this point, they cannot handle it. Nonverbal communication, such as holding a hand, grasping a shoulder, may be also valuable. Stressful situations. Many situations, such as mass casualty scenes, serious automotive accidents, cave-ins, house fires, infant or child trauma, spousal or elderly abuse, and death of coworker or other public safety personnel. Must exercise extreme care in both your words and your actions. Be careful to present a professional demeanor in which words and actions at the scene. Words that do not seem important or that are said jokingly may hurt somebody. Conversations at the scene must be professional. How patients react to injury or illness may be influenced by certain personality traits. Some patients may become highly emotional over what may seem to be a minor problem. Among these factors are the following: socioeconomic background, fear of medical personnel, alcohol or substance abuse, history of chronic disease, mental disorders, reaction to medication, age, nutritional status, feeling of guilt. This assessment will help you to gain the confidence and cooperation of everyone at the scene. You should use professional tone of voice, show courtesy, along with sincere concern and efficient action. Calm reassurance will inspire confidence and cooperation. Compassion is important, but you must be careful. Your professional judgment takes priority over compassion. Your response must be direct and diplomatic, giving reassurance when appropriate. If a loved one has been killed or critically injured, you should wait, if possible, until clergy or emergency department staff can give you the patient the news. You can then provide psychological support the patient may need. Some patients, especially children and the elderly, may be terrified or feel rejected when separated from family members by the uniformed EMS provider team. It is usually best if the parents go with their children and relatives accompany elderly patients. Religious customs must be respected. Some cling to religious medals or charms. If any attempts is made to remove them, others will express a strong desire for religious counsel, baptism, or last rites of death is near. Try to accommodate these requests. Some people have religious convictions that strongly oppose the use of drugs, blood, and blood products. If you obtain such information, it is imperative that you report it to the next level of care. Handle the body with respect and dignity. Expose as little as possible. Learn your local regulations, protocols about moving the body or changing its position. Even in these situations, cardiopulmonary resurrection, CPR, and appropriate treatment must be given unless there are obvious signs of death. Uncertain situations. Times when you are unsure whether a true medical emergency exists. If unsure, contact medical control. If you cannot reach medical control, always best to transport the patient for both ethical and medical legal reasons. A physician must examine all patients who are transported and judge the degree of medical need. You must also realize that the most minor symptoms may be early signs of severe illness or injury symptoms of many illnesses. Can be similar to those of substance abuse, hysteria, or other conditions. You must accept the patient's complaints and provide appropriate care until you are able to transfer care of the patient to a higher level. When in doubt, err on the side of caution and acquire the patient's consent and transport to the medical facility. Stress warning signs and the work environment. EMS is a high-stress job. Understanding the causes of stress and knowing how to deal with them is critical to one's job performance, health, and interpersonal relationships. You need to understand what stress is, its physiologic effects, and what you can do to minimize these effects. Deal with the stress on an emotional level. Stress is the impact of stressors on your physical and mental well-being. Stressors include emotional and physical and environmental situations or conditions that may cause a variety of psychologic, physical, and sociologic responses. The body response to stress begins with an alarm response followed by a stage of reaction and resistance. The 3 stages response is referred to as the general adaptation syndrome. Physiologic responses involve interaction of endocrine and nervous system, resulting in chemical and physical responses. This is commonly known as fight or flight response. These include the following: increased respiration and heart rate, increased blood pressure, dilated venous vessels near the skin surface. It causes cool and clammy skin, dilated pupils, tensed muscles, increased blood glucose levels, perspiration, decreased blood flow to the gastrointestinal tract. Physical symptoms are fatigue, changes in appetite, gastrointestinal problems, or headaches. Stress may cause insomnia or hypersomnia, irritability, inability to concentrate, and hyperactivity or underreactivity. Additionally, stress may manifest itself as psychological reactions such as fear, dull or non-responsive behavior, depression, oversensitivity, anger, irritability, and frustration. EMS, police, firefighters may also be sudden and more severe. Some events are usually stressful or emotional even by emergency service standards. Severe stressors result in what is referred to as critical incident stress. Events that can trigger critical incident stress include mass casualty incidents, serious injury or traumatic death of a child, crash with injuries caused by an emergency service provider while responding to or from a call, death or serious injury of a coworker in the line of duty. PTSD may develop after a person has experienced a psychologically distressing event. It is characterized by re-experiencing the event and over-responding to stimuli. An emergency service provider need not suffer through the emotional aftermath of these difficult situations. A process called Critical Incident Stress Management, CISM, was developed to address this need. It confronts the responses to critical incidents, diffuses them, directing the emergency service personnel towards physical and emotional equilibrium. CISM, or Critical Incident Stress Management, can occur formally as a debriefing for those who were on scene, a trained critical incident stress management team of peers, and mental health professionals may facilitate. The following circumstances would be when personnel are assessed for signs of symptoms of distress while resting before re-entering a scene, during the scene demobilization, in which personnel are educated about the signs of critical incident stress and given a buffer period to collect themselves before leaving. Most common form of CISM is peer diffusing A group informally discusses events that they experience together. Stress and nutrition. If stress is prolonged, especially if physical action is not permitted response, the body can quickly be drained of its reserve. This can leave it depleted of key nutrients, weakened, and susceptible to illness. Carbohydrates, fat, and protein are consumed in increased quantities during stress, particularly when physical activity is involved. Quick source of energy is glucose, stored in glycogen in the liver. The supply will last less than a day. Protein is drawn from the muscles, a long-term source of glucose. Tissues can be used as fat for energy. The body conserves water during periods of stress, retains sodium, exchanging and losing potassium from the kidneys. And susceptible. Other nutrients are susceptible to depletion are the vitamins and minerals that are not stored by the body in substantial quantities. These include water, soluble B and C vitamins, and most minerals. As EMS providers, we do not have control of what stressors we will face on any given day. Consequently, stress is one form or another is an unavoidable part of our lives. Regular and well-balanced meals are essential to providing nutrients that are necessary to keep your body fueled. Vitamin minerals preparations that provide a balanced mix of all nutrients may be necessary to supplement a less than perfectly balanced diet. Stress management. Stress is defined as anything that you perceive as a threat to your equilibrium. If stressful for them, supporting patients in emergency situations is difficult. It is stressful for them, but it's also stressful for you. You are vulnerable to all the stresses that go on with your profession. Lifestyle changes. Your well-being is of primary importance. Burnout is a condition of chronic fatigue and frustration that results from mounting stress over time. Nutrition. To perform efficiently, you must eat nutritious foods. It can be dangerous for you, your partner, and your patient. Therefore, it is important for you to learn about and follow the rules of good nutrition. Fats easily converted to energy, but eating too much can lead to obesity, cardiac arrest, and other long-term health problems. You may also make sure that you maintain an adequate fluid intake. Hydration is important. Exercise and relaxation, common sense. Balancing work, family, and health. Never let the job interfere excessively with your own needs. Find a balance. When possible, rotate your schedule. Critical Incident Stress Debriefing, CISD. If you feel overwhelmed, step back and call for help. Sometimes simply knowing that help is on the way can help you to overcome your fear or anxiety and enable you to respond to the situation. Critical incident stress debriefing is a way to deal with this emotional letdown. CISD, Critical Incident Stress Debriefing, is a program in which severely stressful job related incidents are discussed. Never be ashamed to report your feelings. CISD is designed to accelerate the normal recovery process. A comprehensive CISM system includes pre-incident stress education, on-scene peer support, one-on-one support, disaster support services, diffusing, CISD, follow-up service, spouse and family support, community outreach programs, other health and welfare programs such as wellness, workplace issues. As our society continues to grow more and more culturally diverse, some groups may have been satisfied in the past, accept and participate in American culture traditions, may seek instead to assert, preserve, and nurture their differences. Cultural diversity on the job. The proactive EMT basic understands the benefits of using cultural diversity to improve patient care and expects to work alongside workers with different backgrounds and to accept their differences. As an arm of public safety, EMS has not been around for as long as law enforcement and fire departments. Therefore, there are many less resistance to cultural diversity in EMS than in other areas of public safety, depending on your work experience. Your effectiveness as an EMT basic. You need to discover the diverse cultural needs of your coworkers as well as those of your patients and their families. Although it is unrealistic to expect an EMT basic to become cross-cultural experts with knowledge about all ethnicities, you should learn how to relate effectively. Teamwork is essential. Avoiding sexual harassment, common sense. Substance abuse, common sense. Scene safety and personal protection. Personal safety of all those involved in an emergency situation is very important. In fact, it is so important that the steps you take to preserve personal safety must become automatic. A second accident at the scene or an injury to you or your partner creates more problems, delays emergency medical care, and patients increase the burden on the other EMT basics and may result in unnecessary death. Vehicle stability. You should begin protecting yourself as soon as possible or as soon as you are dispatched. Protecting yourself at the scene is also very important. A second accident may damage the ambulance and may result in additional injury to you, your partner, and the patient. You should park the ambulance at a safe but convenient distance from the scene before attempting to access patients who are trapped in a vehicle. Check the vehicle stability and then take any necessary measures to secure it. Do not rock or push on a vehicle to find out whether it will move. The vehicle can overturn, and send it crashing into a ditch. Body substance isolation. Body substance isolation techniques to protect yourself and your patient. BSI, body substance isolation, is an infection control concept and practice that is designed to approach all body fluids as being potentially infectious. Blood or fluid splash, surface contamination, needle stick exposure, oral contamination due to lack of improper hand washing. Hand washing, most effective way to control disease. Gloves and eye protection. Vinyl and latex gloves provide adequate protection. Wear double gloves if there is massive bleeding. You may also wear double gloves if you will be exposed to large volumes of other bodily fluids. Be sure to change your gloves as you move from patient to patient. For cleaning and disinfecting the unit, you should use heavy-duty utility gloves. You should never use lightweight latex or vinyl gloves for cleaning or disinfecting. Eye protection is important in case of splatters. However, you need not wear goggles if you wear prescription glasses. Mask and cover gowns. The use of a mask is a very complex issue in pre-hospital care. Many EMS systems have protocols that determine the type of mask of use in specific situations. If blood splatter, wear standard surgical mask. Suspected patient of airborne disease, you should place a surgical mask on the patient. If you suspect that a patient has TB, you should place a surgical mask on the patient. In addition, you should wear a high efficiently particle air HEPA. You should not place a HEPA respirator on a patient. If you are stuck by a needle, get blood in your eye, or have any body fluid contact with the patient, immediately report this incident to your supervisor. The Occupational Safety and Health Administrator, OSHA, OSHA, develops and publishes guidelines concerning safety in the workplace. OSHA requires all EMT basics to be trained in handling of bloodborne pathogens and approaching the patient who has a communicable or infectious disease. Hazards. You'll be exposed to many hazards, dangerous, self-contained breathing apparatus, scuba, as needed, hazardous material. You should never approach an object marked with a placard. It is useful to carry binoculars in an ambulance so that you can read the placards from a safe distance. The placards might be red, black, or yellow, or many other colors. But red is flammable gas, black is corrosive, and yellow is oxidizer. Do not enter areas unless you are absolutely sure there are no hazardous spills. Hazardous materials are classified according to toxicity levels, which dictate the level of protection required. The toxicity levels go from 0 to 4. Measure the risk of the substance poses to an individual. The higher the number, the greater the toxicity, the greater the protection needed. Do not enter a scene if a hazmat team is en route. If your area does not have such a team, you must enter. Make sure you are wearing the proper protective gear. Electricity. Your local power company can help you by providing training to evaluate the risk in electrical emergencies. Its staff can teach you how to deal with power lines. Note, you should not touch downed power lines. Dealing with power lines is beyond the scope of an EMT basic training. However, you should mark off a danger zone around the downed lines, like write energized or live power lines. The equipment also has specific storage needs and requires careful cleaning. Dirt and other contaminations can make this equipment useless and dangerous. Disputed overhead wires are usually a visible hazard. You must be careful even if you do not see sparks coming from the lines. Visible sparks are not always present in charged wires. This danger zone extends well beyond the immediate accident scene. Use of utility poles as landmarks for establishing the perimeter of the danger zone. The danger zone must be a restricted area. If you must enter the situation, be sure to wear proper protective equipment. You should always wear a helmet with chin strap and face shield. The shield of a helmet should be made of a certified electrical non-conductor. The chin strap should not stretch. In fact, it should fasten securely so that the helmet stays in place. If you are knocked down or power line hits you on the head, you will still be